From the Toronto Star, I'm Adrian Cheung, and this matters.
Please stand clear of the doors.
The way we get around our cities has completely changed. The streetcars, subways, and buses are nearly empty. You barely have to fight anyone for space in the bike lanes. And the usual gridlock of highways during a morning rush or evening commute, they're nowhere to be seen. That's because most of us, right now, we aren't going anywhere. In Toronto, TTC ridership is down by 85%. That kind of drop in transit is happening in many major cities around the world. Physical distancing makes packing into a bus or a subway car not only nerve-wracking, but logistically really difficult. But there could be some big changes coming. Cities like Milan, hit hard by COVID-19, are planning to revolutionize its transportation network. In parts of London, England, sidewalks are temporarily wider to give people a good amount of space. And that has urban planners and transit developers wondering, is this the moment that we remake how we travel in our cities? Will our problems of bumper-to-bumper traffic, of urban sprawl get worse after all of this is over? Or can we solve the problems we had before the pandemic and make our cities easier and cleaner to move around in after it? We're talking to Ben Spurr, Toronto Star's transportation reporter. Ben, good to talk to you.
Yeah, thanks for having me.
So the world that we lived in pre-COVID, right? One of the biggest things we always talked about in a city like Toronto was your beat about transportation. How do we get around the city? How do we deal with traffic? How do we build transit that works? How do you think that conversation has changed?
Well, I think it's already started to change, of course. One of the most striking things about this crisis has been to see how our streets look so different than normal, right? Car traffic in Toronto downtown has dropped 50 to 65%. There are just fewer people out there. And so it's dramatically changed our transportation patterns for the moment. And I think a lot of experts I've spoken to say that it's going to change things once the city starts to open up as well.
Like the idea of even how we get around, period, when the streets are pretty empty, that whole idea has been recast in a way.
Yeah, I think one of the things that might be most apparent directly after the city starts to reopen up is the effect on public transit. And I think obviously we've seen public transit ridership plummet to about 15% of its normal levels. And I'm not sure that it's at all clear that it will get back to where it was before the crisis. What's notable, I think, is that the TTC's ridership historically is tied to economic activity. We're expecting a pretty deep recession or some kind of economic downturn for the foreseeable future. But just also the fact that the city is going to start to reopen up before there's a vaccine for this virus. That means that we're going to still have to take efforts to reduce crowding in public spaces. And then we get into some pretty serious questions about how do you operate a public transit system that normally carries 1.8 million people a day. How do you do that with having social distancing? And that's going to be something that is difficult to figure out. And I don't think it's a short-term problem. A vaccine is 12 to 18 months away by most projections. So during that time, crowded buses, crowded streetcars, crowded subways are something that we're going to want to avoid. And how we do that while keeping an economically healthy city is going to be difficult, I think.
You also reported on the financials. Do you think the TTC is in real trouble? You already think that it's pretty tough to recover what it was pre-COVID.
Yeah, so unfortunately, the TTC announced temporary layoffs at the agency of 1,200 employees, 1,000 of them or so being transit operators, the people who drive the vehicles. And that's just because they're losing, they say, about $90 million a month as a result of this crisis, and they just can't sustain that. There's been louder and louder calls from transit agencies across the country who are all dealing with this problem for the federal government and for provincial governments to step in with some kind of emergency funding. And we're already seeing that lack of funding have an impact. But as I say, I think with ridership perhaps entering some kind of prolonged slump, those financial problems, especially for an agency like the TTC that relies for 2/3 of its operating budget on fare revenue, it's going to be difficult for that to be a financially stable agency for some time, it looks likely.
So the TTC is facing sort of an existential and logistical problem of how do you actually run a system that fewer and fewer people actually want to take right now?
Yeah, and we've seen the TTC start doing things like essentially blocking off seats on their vehicles, for instance, so that people can't crowd on the seats, rear door boarding on buses and whatnot. So it'll just be interesting to see whether or not those restrictions or similar restrictions stay in place for a long time. It's just difficult to imagine, those scenes that we used to see every morning at Yonge and Bloor of, just people wall to wall packed waiting for a subway. It's hard to see people wanting to put themselves in that situation and the TTC and public health officials allowing for those conditions.
It's a different world now. There's another term that you had also brought up before. It's a weighty term, but the death spiral. What does that actually mean when it comes to transit?
A lot of transit experts will point to previous economic recessions in the early 90s at the TTC, where the TTC saw a decrease in ridership as a result of lower economic activity, fewer people going to work and whatnot. And to respond to that and to the lost revenue from that, they started to reduce their service. Buses and streetcars start to come less frequently. That makes transit less attractive. The data shows that ridership continued to decline over the first half of the 1990s and didn't recover until, I'd have to check the figures on this, but I think it didn't recover until something like 2014. Like it was such a prolonged spiral because transit became less attractive, fewer people took it, and that meant that the TTC had less revenue. That means that they had less ability to provide service. And so it just went into this downward trend that was only reversed when the TTC started to add service to make transit more attractive, kind of disregarded the fact they were losing money on ridership, had enough support to put more service out on the street, and that lifted transit ridership over a number of years.
When it comes to the larger talk about transportation and this idea of how we get around the city, do you think we're in a blank slate kind of moment? Like our urbanists and city developers, are they really rethinking how our streets can be used during this time?
Yeah, well, I think it's really interesting to look at the kind of policies that were very popular right up until the outbreak hit, which was ideas based on creating dense urban communities where people could walk and take transit and cycle to everything they needed to go to and not have to rely on their private automobile. Causes congestion and all kinds of environmental and health problems and economic problems as well. And so that idea, though, all of a sudden of density, according to some experts, I think there'll be a shift away from that because people won't want to live in these dense communities. I think it's inconclusive so far whether or not, dense cities spread the virus more quickly than others. I think there's lots of other factors that go into that. But you could see people maybe wanting to distance themselves from other people with those kind of schemes of dense urban communities, rely on public transit use. With the problems now the public transit agencies are going to be facing, are those policies still viable, those pre-pandemic policies? And I spoke to some experts who say that this will basically reverse all that we're going to head back to sprawl, to people relying on their cars, to people living far apart from one another. But then the flip side, the kind of more optimistic side, I think, is that there are people who do see this as a chance to reset our transportation policies and undo all of the 20th century planning that led to dependence on cars. So you talk to people like Janet Sadiq Khan.
Cities that take this moment to reset their streets to make it easier for people to walk and bike and take transit are the cities that are going to be positioned to prosper after this pandemic and not just simply recover from it.
She's advising on plans in Milan, for instance, to, when the city reopens, restrict car movement and provide more pedestrian and cycling spaces on 35 kilometers of streets in that city. And the plan is to have a resurgence that eliminates some of the dependence on the car and the pollution and the gridlock that comes with that.
That seems kind of crazy because Milan, obviously one of the viral epicenters, but they're already thinking about how to restructure their city post-pandemic.
Yeah, and I think it's just this idea of a reset or a blank slate. I mean, right now, the roads are empty. We can basically go out there and sort of redesign them if we want to some extent. And so it does seem to some urban planners that this is like a golden opportunity to institute those kind of bold policies that we wanted to do before the outbreak, but didn't quite have the same opportunity.
And like you were saying, that people who are planning right now, they see it as we can look at this through an economic competitive lens then.
Yeah. I think that just the idea being that cities that are able to move people more efficiently around are economically competitive and also just, more attractive places for people to come and live. And so that it would position these spaces in these cities in a much, much better space than they were before the pandemic.
What about here in Toronto? I mean, Definitely when people go out for walks, you see people ducking into the streets because people want to give each other the adequate amount of physical distancing space temporarily. Are there any plans here in Toronto to, I don't know, build out our biking network or maybe widen our streets temporarily? Is there any kind of plan like that?
So far, while other cities around the world have started to open up even like emergency pop-up bike lanes and whatnot and widen the sidewalks to give people space, Toronto has so far resisted doing that. And they say that they're following the advice of public health officials who worry that if you do things like that, you're going to attract crowds basically and counteract social distancing. However, I think when the city starts to open up, some people I've spoken to say that the city will have little choice really but to open up more bike lanes and whatnot because of the fact that if we're going to have to limit the number of people who can get on a streetcar or a bus, all those people have to presumably, so maybe some will start working from home in ways that they didn't before, but a lot of people still have to get where they're going, don't have that kind of job where you can just do it from home. But we're going to have to give alternatives to public transit use if capacity is lowered and not everyone has a car. And we don't want everyone to drive a car because that will just clog up our streets more. I think it's interesting in parts of Paris, what they've done is that they're planning to open up bike routes along public transit routes. So as basically the understanding being that we can't all take public transit the way that we used to. So we need to take those same roads essentially or same routes, but now do it while cycling or potentially walking.
You just mentioned it there too, that one of the big worries, it seems, that whenever this pandemic ends, there could potentially be a huge boom in drivers because people may not feel safe on transit, or even the question, how do you logistically do that in a morning rush hour? Or the service might not be that great. Like you mentioned before, it might take 25 minutes to get a streetcar now. How do we avoid the boom in drivers? Is there any talk around that?
Well, so I think there are a couple of factors that could kind of fuel the shift to driving and maybe kind of detract from it as well, right? We're seeing as a result, not only of the COVID crisis, but some other global factors, gasoline prices are lower than they have been in years, making driving a bit more attractive. But we could see more people working from home, right? And people not having to commute. The TTC has also tried to, in the past, talk about ideas like staggering commute times. So the idea of potentially asking employers to set different hours of the workday, for instance, right, where not everyone is traveling at the same time. So that would help not only traffic congestion, but potentially transit congestion as well. You could see some of those ideas to try to limit the effects of the crisis that could add congestion to our streets.
This idea of density, do you see that discussion changing a lot as well? This idea of returning to urban sprawl, because that's something that cities have been fighting against for some time. Is it possible that we start thinking, well, maybe it's not such a bad idea if we give each other that kind of space that we need?
Yeah, I think it's a divisive issue in the sense that from what I have seen, there's not a lot of consensus around the role that density itself plays in transmitting the virus. Obviously, crowding, like being in a crowded, confined space with someone that's obviously against all of the public health guidelines, but actually having a dense neighborhood where people live close together but are in their own homes and whatnot, whether or not that accelerates the spread, I'm not sure that we have conclusive science on. But you do see some urbanists and experts talking about that there will be a push away from dense cities. And that's not necessarily a disaster if we find other ways that people can work. If we're going to go back to a sprawl where people are living in the suburbs and then commuting downtown, that leads to disaster pretty quickly, right? Just the roads can't handle that anymore. The population continues to grow. It's not a sustainable solution. But if we have people moving out into the suburbs, but they don't have to commute downtown, if we focus more on placing employment centers outside of the downtown core, if we have more people working from home who don't have to leave their house every morning, then that kind of shift to the suburbs and away from dense urban centers might not be a catastrophe, but it just might require us to think a little differently about how we design our urban spaces.
When it comes to huge projects like the Ontario line or Crosstown Eglinton, I mean, billions of dollars are sunk into these projects that they will go on for some years. Do you think that any of those projects now is sort of seen with a different kind of lens, or that there might need to be tweaks to the plan because how we get around, at least for the next few years, is definitely going to change?
So far, Metrolinx, which is in charge of the big provincial transit builds in the Toronto area, like the Crosstown LRT and the Finch West LRT and the Ontario line, hasn't announced any major overhauls of those plans throughout this. The construction of the Crosstown LRT and Finch LRT has continued. They say that they're sticking to previous schedules. As far as we know, they haven't officially announced any changes to those. So it seems like those will go on. And the hope is, of course, that by the time those projects are built, 2022, 2023, that we will be back to some sense of normalcy and that, crowding on transit may not be as dire an issue, that we'll have vaccines for this coronavirus. I mean, the short answer is, I guess I don't quite know.
Nobody does.
Yeah, what the fate of those projects are, we don't quite know. But so far, the agencies in charge of them say that they're still on course.
Ben, so much of your work really revolves around what is the best way for us to get around the city and what kind of projects and what kind of money we're spending on figuring out a transportation network, a transit network. Do you think the way we get around dense and growing cities like Toronto or Vancouver or Montreal, do you think that idea is changing forever?
I think it's changing for the foreseeable future, at least. I think just from a practical standpoint, the next potentially, year and a half, 2 years, public transit won't be able to be used, I think, in exactly the same way that it was before. And that has all kinds of ripple effects about having to find alternatives. And really, I think most experts you speak to will say that more reliance on private vehicles is not an option. And so then the only other option is, pedestrian space and cycling. And I think you could see a greater emphasis on those projects and see a greater investment in those. And we are starting to see that in cities around the world. It's also possible cities won't take that route and just let the situation play out as it does. And that could involve people making their own choices that ultimately are unsustainable, that lead to more people driving their cars, more congestion, lower quality of life for everyone who lives in those cities. So I think, these are all issues that had been talked about before this pandemic. But I think a lot of experts will say that, and not just in the field of transportation, a lot of people talk about how this outbreak has exposed pre-existing problems in the economy, for instance, and who is considered an essential worker and who gets paid, whether or not they're deemed essential workers, expose a lot of inequities in our economy, for instance. I think a lot of transportation experts would say that this crisis has exposed a lot of pre-existing issues with our transportation policies. And I think there's a split on whether that means that we should double down on those policies that focus on public transit and cycling and walking, or the counter argument is that the pandemic is proof that those ideas no longer work and we have to come up with something else. So I think these are pre-existing issues that have just been shed into kind of stark relief as a result of this crisis.
Ben, what a weird time it is. I mean, a month ago, we were talking about fare evasion, I think, on the TTC. And now these are big existential questions that none of us really had to think about before.
No, not at all. But I mean, even fare evasion is still a thing that one question to ask is, while the TTC is operating on lower service, should the fares be lower? Should they still be enforcing fares and all those kind of things? But all these issues that pre-exist are taking on new importance and new angles to think about them. And it's a weird time.
Ben, thank you so much for taking the time.
Yeah, thanks for having me.
And that's Ben Spurr. He's Toronto Star's reporter on all things transportation and transit, and now thinking about what that even looks like in a post-COVID-19 world. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.